Okay, so this is the fourth video, which is the renal system. This will be just a short reviewer. We will go with the overview, anatomy and function, and embryological development. So first is the overview of the urinary system. So the primary role is to filter blood, produce, store, and excrete urine. It is divided into upper and lower tracts. So upper, it's the right and left kidneys and their respective ureters. So from the kidney going down to both left and right ureters. And lower urinary tract is the bladder and urethra. So that's where you can also classify lower and upper urinary tract infections, where it's coming from. Next is the anatomy and function of renal structures. So the kidneys. The kidneys are bean-shaped retroperitoneal organs responsible for filtering blood, producing urine, regulating fluid balance, which is also termed as osmoregulation, and performing endocrine functions. And due to the liver's position, the right kidney will be in the level of L1 to L3 and sits slightly lower than the left, which is on T12 to L2. In gross anatomy, each kidney is about 10 to 12 centimeters long and has 3 protective layers. The outer is the renal fascia. This is very important for those who are in urological surgery. So the layers, the outer is the renal fascia. This is the first one you will see. A middle layer of adipose tissue, which is the perinephric fat, and an inner renal capsule. Internally, the kidney consists of an outer cortex and an inner medulla. So that's very important. Outer cortex and an inner medulla. The medulla contains the renal pyramids, which are separated by extensions of the cortex called renal columns. So you can see and you can just look at it online, what it looks like, because this is just a review. Next is the urine drainage. Urine is produced in the nephrons, which passes from the renal papilla at the tip of the pyramids into minor calyces, which then merge from major calyces. And then they drain into the renal pelvis and exit via the ureter. So in the nephrons, it passes from the renal papilla at the tip of the pyramids into minor calyces, which merge to form major calyces, then drain into to the renal pelvis and exit via the ureter. Its blood supply. The renal arteries branch directly from the abdominal aorta, and the renal veins drain into the, of course, the IVC. Next is innervation and pain. The kidneys are innervated by sympathetic lesser abdominal splanchnic nerve. So that's splanchnic nerve, and parasympathetic, which is the vagus nerve. So those are the two fibers that innervates the kidney. The sympathetic, parasympathetic. Sympathetic is the splanchnic, S and S. Sympathetic, splanchnic. And parasympathetic, it's vagus nerve. Pain signals from the kidneys travel from via the visceral afferent fibers to the T11 to L1 and spinal levels, resulting in pain felt in the loin or posterior flank. So in the loin or posterior flank. Next is the nephron. The nephron is the functional unit of the kidney, as we all know. That's just a review. And it has over 1 million per kidney. So in a way, you're a millionaire. So there are two main types. First one is the cortical nephrons, 80 to 85%, and it's located mainly in the cortex, with shorter loops of Henle. Next is the juxtamedullary nephrons, which is 15 to 20%. They have long loops of Henle that extends deep into the medulla, crucial for creating concentrated urine. So that's for the juxtamedullary. So a nephron consists of the renal corpuscle. So it's the glomerulus and the Bowman's capsule, and it's for filtration, and the renal tubule, which contains the PCT, loop of Henle, and DCT. So PCT is the proximal convoluted tubule, and DCT is the distal one. And it's for reabsorption and secretion. Next one will be the ureters, bladder, and urethra. Muscular tubes. So ureters, these are the muscular tubes, 25 to 30 centimeters, and they transport urine from kidneys to the bladder via peristalsis. And pain radiates from loin to groin, T11 to L2. If your patient in your clinic says they have pain that's coming from the loin going to the groin, it's in the ureters, and most likely your culprit is the stones. Next is bladder. This is a muscular organ for urine storage. The trigone, so remember this word, the trigone, this signals the need to urinate. So if it touches that or tickles the trigone, that's when you will have the urge to urinate. And parasympathetic nerves, so P makes you pee. So it's the parasympathetic nerves that has the lines the bladder, and it stimulates contraction for emptying. So pain is felt in the suprapubic region. So if it's in the suprapubic region pain, you can list the bladder as a culprit. Next is the urethra. It conveys urine out of the body, and it has an involuntary internal sphincter and a voluntary external sphincter. So the voluntary is the external, involuntary is the internal. So involuntary, internal. And this could also be, this is lined by the pudendal nerve and S2 to S4. And for the embryological development, it will develop from the intermediate mesoderm, which is the kidneys and ureters, and the endoderm, which will be the bladder and the urethra. So intermediate mesoderm, kidneys and ureters, which is also, as you've seen, this is the upper one. The upper will be the intermediate mesoderm, and the endoderm, bladder and urethra. So kidney development, it proceeds through 3 stages. So the rudimentary pronephros, the temporary mesonephros, and finally the permanent metanephros. So permanent is metanephros, which ascends from the pelvis. The bladder and urethra development, they arise from urogenital sinus. And the congenital anomalies, these include renal agenesis, which is an absent kidney. Next is the pelvic kidney, which has the failure to ascend, so it stays there in the pelvis. And next is another one is the horseshoe kidney, which has fused lower poles of the kidneys. And another one is the hypospadias, which is an abnormal urethral opening, and it can be seen especially with males. Okay, so that's the overview of the renal function. So I urge you to take the quiz and read on the potential essay questions and model answers. So like and subscribe if you find this useful, and follow for more.